Hi, I'm the medical director of the Center for Sleep and Human Performance. My name is Dr. Charles Samuels, and I'm here with our director of behavioral sleep medicine, Catherine Rasmussen, who has a background in naturopathic medicine. And we're going to talk today about the relationship between the stress that people are under now with the COVID pandemic and how it disrupts their sleep and then undermines their ability to be rested and cope better with the stressors of their days, which everybody knows is very extensive, from financial stress to having family at home and kids not in school and working from home. So I'm going to just dig right into it and ask Catherine some questions, and she's going to give us some answers about things. So Catherine, from your perspective in behavioral sleep medicine, what's the focus of your treatment when you're treating people who come in with difficulty sleeping?
Well, particularly for people who suffer from chronic insomnia, the focus is to help to decrease the hyperarousal. And hyperarousal is a factor that perpetuates insomnia. It's kind of like having an on button that just won't switch off. And so using many different techniques at our clinic, including relaxation training, meditation, mindfulness, as well as healthy sleep behaviors, we help patients learn to turn that switch off so that they can sink into sleep and they can relax. A lot of these people are in a fight and flight sort of state where they just can't let the body let go. And so, the whole idea of sleep is the passive release of the awakened state. And that's really what we help them do.
That's great. So I think what's important too is that patients and the general public will often go if they can't sleep, which is common now because of the stress. They'll go to the pharmacy and get over-the-counter sleep aids, which we as sleep physicians would discourage people from doing because there are very effective behavioral methods for improving sleep difficulty, not using these over-the-counter medications, and that would be our big message. But Catherine, when you are doing this treatment and trying to get people to relax, what do you think is sort of the one or two best things that work most effectively for patients?
In terms of relaxation training, definitely diaphragmatic breathing, because it helps the person get into what's called the parasympathetic state. That's a part of the nervous system that allows us to digest our food well and helps us relax and helps us sleep. And so that really helps to calm the nervous system. So that would be one.
Can you describe Can you describe what it is?
Sure.
For people?
So diaphragmatic breathing is essentially where you're breathing and allowing the belly to expand. So I'm just going to give you an example of how we do this. That's okay?
Yeah.
Okay. So I'm going to inhale. And then exhale. And if you notice, and if you put your hand on your belly, you'll notice that as you inhale, the belly expands. And as you exhale, the belly moves back in towards the spine. Most people are shallow breathers, and they often breathe erratically. And this is one of the things that perpetuates this state of fight or flight response. And so a very quick technique to get you into parasympathetic, to get you to relax, is just simple diaphragmatic breathing.
What would be another one besides breathing that you might use with people?
So I also like progressive muscle relaxation too. It's very easy and it's a very tangible thing. It's something that you can really feel in your body. And so it's like we basically start with the toes and then go all the way up to the top of the body. And so an example would be you squeeze your hands really tightly on the inhalation. So I'll demonstrate one aspect. So inhale. And then exhale. And the exhalation, the relaxation response, is twice as long as the inhalation when you're doing progressive relaxation. And so, and it's a focus too. It also distracts people from worrying about their sleep, and it makes them feel empowered. They feel like they're actually doing something to take control of their sleep again too.
Yeah, thanks. So I think it's really important to understand that as physicians, certainly in sleep medicine, we try really to stay away from medication, and the tradition with difficulty sleeping has been to give people sleeping pills, and we really want to discourage that. So we have experts here at the Center for Sleep and Human Performance whose full-time job is to treat these problems without medication, and that's our real goal. So people who are struggling, and I know it's a very difficult time, can certainly go onto the website of the Center for Sleep and Human Performance and self-refer and come in, and their clinic visits here are covered by Alberta Healthcare. So it's of no cost to the patient, and we really want to reach out and help people and let them know that we're all in this together, and if you're struggling, there is help for you.